Communication is an important facet of life. Communications are essential in all aspects of life. My future occupation will be in speech-language pathology. Speech-language pathologists assess, diagnose, treat, and help prevent communication and swallowing disorders. Speech-language and swallowing disorders result from a variety of causes such as a stroke, brain injury, hearing loss, developmental delays, a cleft palate, cerebral palsy, and even emotional problems. Having a communication disorder can affect one's everyday life with learning, literacy, and even social interactions with their peers. Effective communication in speech language pathology industry is incredibly important in aiding in the correct diagnosis of an individual's condition. It is very important that both the speech-language pathologist and their patient are very clear in what they say to one another. When a speech-language pathologist is doing speech therapy with a child in grade school, you want the parents as well as the child to understand very clearly in what is going on during treatment and what the plan will be. Speech-language pathologists can work in many different settings. They can treat patients in a medical setting, private setting, or even a school setting. If a speech-language pathologist is working in a medical setting, or he or she would be treating and doing therapy with stroke victims, victims with traumatic brain injuries that are called TBIs. If a speech-language pathologist is treating a patient who had a stroke and the stroke has affected the patient's ability to verbally communicate correctly, the speech-language pathologist would do therapy on teaching them how to verbally communicate again by using their tongue. They do different methods by strengthening their tongue muscles and learning how to swallow again. Speech-language pathologists as well work with patients that have had traumatic brain injuries. A patient could get a traumatic brain injury by getting hit in the head severely or being in a very bad car wreck and having damage to their frontal lobes, causing cognitive problems. Cognitive problems are problems with memory loss, focusing, and interacting with others. Um, in schools, speech-language pathologists provide evaluation and remediation to students with articulation, fluency, which is stuttering, voice, receptive language, and expressive language, which is sending messages and receiving messages and understanding them. Pragmatic language, which is interacting with others in a social environment. Oral, social skills, and swallowing. Speech-language pathologists can do amazing things with speech therapy and just communication in general. Speech-language pathologists work with all types of communications and disorders. They can prevent, assess, diagnose, treat, and help prevent communication and swallowing disorders. Becoming a speech-language pathologist is hard work and it takes a lot of determination. It's hard work and it takes a lot of heart. You have to be compassionate in what you're wanting to do.